My name is Dr. Jennifer Ann Pallone, and I am a neurologist. I practice in Merrillville at the Neurological Institute and Specialty Centers, where my area of expertise is in Parkinson's disease management. And in that practice, I'm able to provide a lot of specialized care for the specific disease of Parkinson's disease and its problems, which can become quite extensive. Well, Parkinson's disease is an illness of the brain, and the disease actually has a lack of dopamine because there are cells in the brain that are dying before they're supposed to. They are an area of the brain called the substantia nigra, that as those cells are dying, they're no longer making a chemical in the brain we call dopamine. And when that dopamine loss occurs, there's a chemical imbalance. Due to that chemical imbalance, the patients will have different symptoms of Parkinson's disease. Those symptoms of Parkinson's we refer to predominantly are slowness of movement, we call bradykinesia, rigidity of movement, which is stiffness of muscle, and that occurs typically in an arm and a leg, usually more on one side of the body first, and also tremoring, which typically occurs in a hand first but can occur in a leg first, and then also there's some trouble walking. The patients might over time develop balance trouble, not usually in the beginning, but over time they will have trouble with balancing when they walk. And those are the main features, what we call the cardinal features of Parkinson's disease. There's things that have been determined to be related to the cause of Parkinson's disease, but the exact cause of Parkinson's is still under research, which is where a lot of research dollars still go in the evaluation of why do patients get Parkinson's disease. The ideas behind Parkinson's include that there is a genetic predisposition. There are genetic markers that can be evaluated in patients. You can look at a patient's genetics and evaluate if they have some of those markers, but that's not the whole story. So to say that I have a genetic factor does not necessarily mean that I will express Parkinson's disease. We do believe there are also environmental factors that contribute to that genetic marker being expressed. So those two factors are probably the biggest ones. And what in any one patient, which environmental factor and whether or not a genetic factor is what caused that patient to develop Parkinson's disease is not exactly known. So it's complicated, and they're still working on that. So our most exciting program we have coming up will be our 4th annual symposium coming up. We're very excited about that, and that'll be on April 21st, 2012 on Saturday, Living Your Best Life with Parkinson's Disease. This is our 4th annual symposium, and it is going to begin at 8:15. The doors will open at the Avalon Manor in Merrillville, Indiana. You can come, the registration is open, and you can come there and register. You do not have to register ahead of time. We're going to have an exciting program with many speakers. We are having our coast-to-coast speakers. There's going to be a speaker, Dr. Melanie Brandeber, coming from California. We have also a speaker from the Michael J. Fox Foundation that is going to talk about demystifying clinical trials, and that speaker's coming from New York. We have Dr. Michael Rezac, who is going to come and talk about the surgical options for Parkinson's disease. I'm going to speak about medications, and I'll give you an update on some of the newer medications that are on a study and some of the newer things that are out there. Dr. Mavralis is going to talk to us about some of the gastrointestinal issues that Parkinson's patients do deal with, and we have Dr. Nasser talking to us about depression and anxiety and the mood problems with Parkinson's patients. And we're going to talk about exercise, as we always do. We're going to talk about nutrition, and we also have a speaker who's going to talk to us about Social Security disability programs. So as usual, we're going to give us a nice broad view of Parkinson's disease and issues that you're dealing with, educate you and empower you to do as well as you can do and even better than you think you can do with Parkinson's and living your best life.